All right, so we're going to get going just to make sure that we keep to our time schedule. I want to say welcome to everyone that has signed on. It is exciting to see a whole lot of you here, and I'm sure there's a lot more that's going to be joining. There's also a lot of people that will be getting the recording of this webinar to listen to in their own time. So, guys, just a little bit of background. So, the Zone 1 webinar, the idea that I have with this is to create a space where we can catch up, and it's probably going to be every 2 months. I'm going to be available to share an interview with a guest, and we're going to get an interesting guest on each time with a specific theme for each meeting that is relevant to the work that we do. And I'm also going to share with you a little bit of insights from my experience of the work on that specific topic. And then we're going to be sharing with you the news of the Be Activated world, what's been happening in the last couple of months, what is happening coming up. And at the end of each webinar, we will have a questions and answer session where I will be taking some questions and I will answer most of them. I probably won't be able to get through all the questions. And the idea would be that I would keep those questions that come up, and we will then look to try and answer those questions on my social media platforms in the weeks to come. So on that point, if any of you are not following me on social media just yet, then please make sure you get onto my Instagram account. I am on Facebook, but these days mostly post on Instagram. There is at least 1 or 2 posts per week, which is aimed at supporting you guys, aimed at teaching, and would be relevant for you as therapists and activators that have done our courses before. And make sure you follow that, because the questions that I don't answer live, I will try and get to most of those on social media in the weeks to come. That will pretty much be the format that we're going to be following. So if I can start with what's new. In the last couple of months, we've had a number of courses around the world. We started with our 4-day of teaching in Melbourne, and we were fortunate, for those of you that attended, some of you are here, for Doug to have come out and for the two of us to teach together for 4 days here in Melbourne. We had a full class with almost 30 attendees for all 4 days, which was great. And yeah, we had a great time. There was some interesting therapists attending, and we all learned from each other, and it was a great event. It was good for me. I got to spend some time with Doug both before and after the 4 days, which is always where I get to learn a bit more again. And also, the course was a bit different this time around. So for those of you that have attended, when we teach the 4-day course, we tend to take things a lot slower. And what 4 days means is we teach the level 1 and 2 course pretty much over 4 days, and we allow the level 1 work to extend in the time that's required for it. And often the level 1 work will extend further into the 4 days, making sure that we're not rushing through it as much as we used to have to in the past. And also because we're adding so much more into that. There's always, for those that have been recently, there's new techniques. There is difference in the sequence and how we treating from even a year ago. There is different and additional tests that we try and add in that is relevant in different situations. And our aim is to give you everything there is at the moment in the courses, and then for you guys to apply that to what is appropriate for you in your practices. So that was really great. We had a good time, and me and Doug managed to teach together really well, which for me was a really good experience and also a good learning experience. From there, Doug left. He went to the US. He did 2 further 4-day courses in the US, and from there he hopped over to London, where he did another 4-day course. So a very busy month for Doug. He's home now, and I caught up with him in the last week and did a little bit of planning for the year ahead. And he had a good time, and it sounds like it all went on well, and the courses are pretty much well attended all around the world at the moment again, which is really good to see following the COVID years. From my side, we're busy looking at extending the courses, hopefully at the end of the year, to New Zealand, and also still negotiating with the guys in Dubai. And if all goes well, we'll hopefully be teaching there a little bit later on. And then I'm also hoping for another 4-day course in Australia this year. I'm still finally deciding if it will be in Sydney or in Melbourne, but keep track of my socials and I'll be posting those dates as soon as we have made some final decisions on that. Then for today's webinar, we have a special guest. So the topic of the webinar is activations and mental health. And it's a topic that I chose because it's something that probably lies close to my heart and the side of the work that I enjoy probably the most. And I've invited someone who's got who is an activator today, but someone who's got an incredible story with his own journey with mental health and how he found activations along the way and how that impacted the years after. So I'd like to welcome Niels Jensen to the podcast today and to the webinar. It is good to have you here, Niels. I'm going to share just a little bit about Niels that I've been exposed to. So Niels has got this incredible story about his own battles with mental health and physical illness, and how, from what I understand, we'll hear a bit more later, how he discovered Be Activated quite randomly, and how this had a massive impact on his health moving forward. So I first caught on to Niels' story on a Facebook message that popped up on my inbox in 2018. And Niels, if you're okay with that, I'm going to read to them just the message that you sent me originally, and then we'll take our conversation from there. So this was the message I received way back in 2018. So Niels sent to me, Carl, I've just read your post on the Be Activated group. Awesome stuff. I feel I have to share my story that is very similar. I have been battling depression for 4 years and chronic pain for 6, in my whole body pretty much. I have hypertension. I have TMJ disorder like crazy. I tried everything against pain and depression, but nothing seemed to work for me. I found out about Be Activated a few weeks ago, and it changed all of it. So Niels, I'm going to leave it there, and I wanted to introduce you, and I wanted to ask you and to share with us a little bit about where were you at in your life when you sent that message? What was it that you were dealing with, and how did you discover Be Activated?
All right, thank you. Yeah, so it's been quite a journey. It started about a little over 6 years ago. As Karel said, I've been struggling with depression and anxiety for years, and also I used to compete in powerlifting, which basically means that you have pain everywhere. So that was a big part of it all. In my search for pain relief, that's how I that I found Be Activated. So it was never a goal to help with anxiety or depression in any way. So I was starting to look for different ways. I was at physios and chiropractors and yeah, everything I could find really here in Sweden. So I was exploring myself, searching a lot of YouTube and stuff like that, if there could be stuff that could work against my pain. I was in chronic pain. I was told I had fibromyalgia, I think it's called in English, and yeah. So and one night I saw, it was actually, the first one was a hashtag on an Instagram post where someone did a glute activation with incredible results, and I thought, but what was that? It looked a bit sketchy at first, as probably all of you think as well about this work. So I looked further. I was watching YouTube and found some really old videos of Doug showing stuff, getting interested, even more interested. So eventually I found some pictures of the RPR warm-up drills, which is kind of like, yeah, some of you might know them, but they're similar, a bit similar, but it's self-activation. And I was starting rubbing some points and doing some tests, and it just felt different. So my body just started feeling different. And then I just kept searching, looking further. I found the website. There wasn't too much information, you know. Doug keeps a lot of this secret, as some of you might know. But I found the website, and back then you could order a USB stick with some training on it. So I ordered it, waited a couple of weeks, came, watched the stuff, found the self-activation, learned about the sequence. This was really old stuff, but I started applying it to myself, and yeah, I started feeling different in many
And Niels,
ways.
what was the main things that you felt? What was the differences that you felt initially?
So it was that I just suddenly started breathing. So what I noticed is that a lot of us that's done the work is that we don't know what we don't know. So that's kind of a big part of it, right? And I had no idea that I've been holding my breath in pretty much everything I did. So every time, pretty much in all kind of movements and I mean, I was a power lifter as well. So everything was learned to take a big breath, hold in, and then move. So there was no really movement, and there were no separation in movement and breathing.
Yeah.
I was holding my breath during pretty much all physical activities or even simple movements, getting up out of a chair or anything like that, but also in social encounters, reading an email. I was having these apneas all the time. So after rubbing my chest for the first time, I just suddenly started breathing on my own, and there was a separation between breathing and movement. So they weren't kind of dependent on each other.
Everyone,
That
I
was
guess,
the initial.
has different experiences with these things. But if I reflect back to the first time this work was done with me as well, the most astonishing thing was I was just driving in the car back from my first level 1 course, like some of you have been on, and I just remember breathing and just sort of feeling so weird that I'm taking these big breaths. And it's like you said, that we're typically unaware that we're breathing so inefficiently, and unaware how that would have been impacting your performance as a powerlifter and everything else in your life. Because it, as we all know now, if it's a vital function, and if we're not breathing correctly, there's obvious things that go wrong. But if we're not breathing correctly, it has a massive impact on where your mental state is at, and that influences everything from how we move, but also to how we feel.
Yeah, definitely. So that was a huge shift, and it also dropped into my belly a lot more, and there was suddenly a lot of movement in my belly. Along with that, I felt the ground differently. I felt another sort of orientation in some way that I wasn't familiar with. There was some sort of grounding, which was also new, and the calming effect. The world slowed down a little bit. It was massive, but not. Really what happened after that has been
Yeah.
even further. So yeah, that was the big shift, feeling the ground, feeling my body a little bit more, knowing a little bit more where I was, and the breathing kicked in, which broke some of this hypertension, because the body kind of let go of some stuff that it was holding on to. Holding on to your breath for me is a lot like holding on to everything, really. So you're not really letting stuff go.
Yeah.
And I've been holding for years. So that was a big relief, a sigh of relief. Was the first, uh,
Yeah. So
along with a lot of confusion.
yeah, because I mean, realizing these things about yourself, it can be quite a frightening experience as well. That one suddenly realize you're not in control, and
Yep.
that, as you've said already, can be a scary experience. Now,
Yep.
Nils, I read in our messages before, looking back to that prior to you starting to explore and to be activated, you've been seeing various healthcare professionals, as you mentioned, and also seeing a psychologist and having cognitive behavior therapy for 2 years. And I read back and saw that you wrote to me that your therapist particularly noticed that you suddenly had a genuine happiness in you that she hasn't noticed in you for the 2 years prior to that she was working with you. How did what was your experience with it?
Uh, yeah. So I was this kind of like I was this big power lifter, just being what I realize now, being scared pretty much. I was in this constant defensive pattern, like standing like this and being almost kind of frightful. Maybe that would be the look people had of me. And suddenly, I remember her saying later on when she saw that I started letting go of stuff, that in the start of our sessions and treatment. Um, with the shrink, that was like, I have a panic alarm button, you know, like if the patient is freaking out. She was a bit scared because I was in such a always fight flight state, you know. And eventually I dropped some of that, and she saw, like, she said, what the hell happened to you? So it was a letting go of something, and it was a more of a presence. It was more of a happiness. It was her explanation of what she saw. But looking back at it, I just think that it could be I was in this constant fight mode, I was rarely aggressive outwards, but I was always on my guard, you know, like tensed up and ready to go in a unhealthy way, I would say. So some of that let go, and she saw that. She's been seeing me for about 2 years back then. So yeah, she noticed the difference, definitely.
Awesome. And I think maybe something just to mention here at the start of the talk is when we talk about using activations for clients with that has mental health issues, we're definitely not saying that this takes away from the value of those type of cognitive behavior therapies, of the counseling that one would have with a trained psychologist. It's more that there's maybe something that we can add. If we can help our clients to physically unlock, if we can help our clients to physically unlock their bodies in order for them to breathe correctly, in order for them to move correctly, it allows for a shift in their nervous system, which the way I describe it, and we'll talk about that a bit more later, is creating a little bit of capacity for the client to then be able to change their behavior so that they can actually apply these things they're trying to do with a counselor, and suddenly they get a lot more value out of those sessions, and it's something that can add to it rather than take away from it.
Yeah, definitely.
Niels, so following, well, actually, if we go one step back, when you started doing these things on yourself and you started seeing or feeling these changes, and even your therapist noticing these changes, what did you think of it? Was it strange for you? I always think, was it strange for you discovering this on your own? I would assume you were sitting there in front of your computer, rubbing points behind your head, rubbing points on your abdomen, and then weirdly feeling happier or more present in your sessions with your psychologist. What did you make from all of that, not knowing really what it was about back then?
Yeah, so that could maybe in some way add some kind of stress that you want to figure this all out, and sometimes in the start of Be Activated, and still today, that it couldn't be because you're always grasping and looking for some kind of control, and trying to understand all of this was also made some confusion and maybe some stress in some way, but it honestly just felt more like me. It wasn't that I added on something, and that's a big part that I'll talk later on as well, but it felt more like how it felt before, like before all the so it wasn't, it was more like a deja vu, if I can say it like that, and letting go of stuff, not adding on too much, and it was amazing. I was just happy about the fact that I started feeling a bit more like myself again.
Yeah, I guess that's something I see with the clients that I work with often as well. We as therapists, when we teach or in our heads, we can sometimes struggle with some of these concepts. But if a client feels the change in their body, and then they're normally immediately on board. When they feel different, that's normally more than enough for them. And you had it in an extreme way because you experienced this without anyone explaining to you really what it was about. And that would have made it a lot more, yeah, I guess, confusing. But
Yeah.
incredible to see that you came through the process like that without necessarily having all the guidance that some of our clients would have when we work with them. So from there onwards, I remember we then thought, well, we need to get you to someone to actually work with you. And we managed to get you connected to Christopher, who is Doug's course, used to be Douglas's course organizer in Denmark and a very well-trained therapist in this field. And you ended up managing to get to some sessions with him. How did things develop from there?
Yeah. So I live in Sweden, the south of Sweden, so it's really close to Denmark and Copenhagen, where Christopher. I shoot him an email. I eventually got an answer. I got a session booked for I think it was quite the waiting time to get a session with him. It was over a month, I know. So I ended up getting there. I want to make clear that I was still having a lot of issues with this. It was more a way to handle it, and I just like saw a glimpse of something else. So there were still issues. I was still having these panic attacks. There were ways to manage it, but not really. I kept doing this stuff, and it was amazing to finally have some sort of way to handle it. But yeah, so I eventually got over to Christopher, and I remember sitting in the waiting room outside of his clinic and having sort of a panic attack back then as well. You know, like it was a lot of stress, a lot of uncertainty. I had a lot of troubles with traveling because I got this kind of fright on buses and trains and stuff. And as well going to new places because uncertainty, you know, that
Yeah.
we're fragile. I didn't have too much resilience, so that was stressful. And during our session, he was amazing. He was listening. He was present. He was caring, and we saw that I was a zero pattern. So if any the ones who have done the teaching, you know that their zero pattern doesn't have a strategy, overwhelm, driven on adrenaline and stuff like that, stress hormones. So
And if I can jump in, they also typically end up controlling the environments, because as long
yeah,
as if you're a zero pattern and your nervous system is feeling overwhelmed, it makes us feel unsafe. So one of the ways we create safety is by controlling everything around us. And as long as we know where everything is, we know when everything is going to happen, then it makes us feel safer. But
yeah,
as Nils has already explained to you guys, when you're then going out of those environments, then suddenly things are very threatening and hard to. And unfortunately, unless we hiding away at home, the world keeps throwing unexpected things at us, and that's when it gets challenging, when your only strategy is to control.
yeah, exactly. And there's so little in our control. So it was, as you say, it was really frightening. But we did a session. He obviously I had some background because in the USB stick that I got there is explanations of the 1, 2, 3
Yeah.
pattern, the fight, flight, or rest, digest, the staircase, a little bit about that you guys probably heard about. And so he didn't have to explain too much about the philosophy, but we did some treatments. We did some activation and the testing, and it was just amazing. Like I had never experienced anything like it. The nervous system just calmed down in 10 times the way it did when I did my self activation. I felt so strong. I couldn't believe how light I felt, and the way I could squat down without the pinch in my hips, and the ease and the presence and the I was so confident. Like there was no need to control the environment anymore. That's the way you can say it, and that experience is quite freeing and a big relief because controlling takes a lot of energy, and suddenly there was an ease in everything. And I remember going over the bridge. There's a huge bridge between Sweden and Denmark, and I remember going back over the bridge on the way back, and just everything, just the colors were different. The vision field was more open. There was another presence. There was another. Yeah, just the absence of fear is quite huge when you've been having fear as a baseline for so long.
Yeah,
So
I
yeah,
think
it was amazing.
what I like what you say there is it's not that Christopher probably told him to stop controlling his environment, but as soon as he felt safe, he felt suddenly you don't have the need to control anymore, because you're actually feeling safe, and as you said, confident in where you're at and in the space that you're at, and suddenly then the need for all these compensations is just not there anymore.
Yep, yep.
Incredible. Okay.
Definitely, yeah. So I ended up again, it lasted, and I kept activating, and I felt different, and it was amazing. I kept doing the work because that's a big part of it. He was saying work on these points a little bit more than that because we were doing some stuff. I got this little painting he did, like do activate these points and stuff like that. So I kept doing that. I had a follow-up session maybe a month or two later, where again we just kept dropping down the staircase. We were doing stuff to my jaw, which was amazing. And I kept getting this really, anyone who's had an experience of these shifts that can happen, it's really something that you didn't know that you didn't know. So we kept unfolding patterns and stuff going further. And yeah,
I like that you gave your homework.
yeah,
That for me is great. You know, in the end, whatever client we're working with, whatever condition they come to you with, in the end, it's our client's responsibility to also, you know, we as therapists, we're there to show them and help them to understand sometimes a little bit about what might be going on with their body, helping them to take some barriers away in their body so that they can actually figure things out on their own about what is happening in my own body. But then giving them the responsibility, I think that's important. That, you know, you could have treatment every week, but in the end, you need to learn, and we need to give our clients some sort of skills that they can take home so that they can manage these things on their own at home. And I think that's really important from what Christopher did for you, even in that first session.
Yeah, definitely. And he showed me what was possible. It was more like that. It wasn't really lasting in a way, because I mean, I still had some internal patterns that kept. So at some point we need to, I say this to my clients as well, that at some point we need to look at, there's a saying that instead of just pulling people out of the river, we can go upstream and see why they fall in. So I think that's a big part of it. To now, at least I knew that something else was possible, and then I had new reference points. So I knew where I could be. So I started figuring out, this is where I'm at, where I am. I know there's something else than this. So then I can work towards that kind of. That's.
It sounds to me, if I hear what you're saying correctly, would you say it's that, and does that give you hope when you've seen there's a different possibility, even if it's not lasting at that point?
100%. Like if I could even experience that feeling for 10 minutes, that would be huge, because that means it's possible. If you've been stuck in something that long, that hope is definitely something you lose. So that was huge. That it showed that, what the hell, it's possible, and that changes everything.
And I always say to clients, because sometimes people will have a big shift with treatment and they'll regress, but once they've seen what's possible, then we know what is possible. And then we can, the aim of the game is how can we get them there more often? And if we've never been there before, then even being there for one day is a massive success. But how can we then make it 2 days and then a full week? And how can we build that resilience eventually to get our clients to a point where it's something where they can maintain it more often than not?
Yeah, definitely. So figuring out, learn where you are, because you need to know where you are, and because showing someone they can be at this place, then they need to figure out, okay, where am I now compared to that, and so we can start working on getting them there more often than not.
So if we go on with the story from there, then we started sort of chatting about that we should try and get you onto a level 1 course somewhere. And at the time, Doug was teaching in London, which seemed to be the obvious choice because that wasn't too far from you guys. And what I particularly remember is that you had to work hard to get onto that course. It wasn't just the easy thing for you to get there. You had to make some very specific plans financially to make it possible for you to go. What I like about that and still remember about that is that you had to work for it. Was that how it was?
Yes, so actually the first course was in Denmark. So it was Christopher who also said, so London was years later.
Okay, I'm confused. Yes.
And so the first course was there, and still, like, I'd been on sick leave for years, and I couldn't really afford the course, so I had to do some adjustments with that. But the first course, so Christopher's suggestion was that instead of booking another session, there's a few months till there's a course. So I decided to do the level 1 course in Denmark instead of furthering our sessions with Christopher, because that was our next plan in the treatment. So that's in November 2018 I did my first level 1 course in Denmark.
Sometimes it takes hard work. I think something just to take from that is it takes commitment from clients to sometimes improve the situation. You know, we as therapists can show them what's possible. We can try and get them to understand what's happening in their body, help them to to unlock their bodies so that it's a little bit easier for them to achieve. But in the end, responsibility still lies with the client, and often it means they have to commit to either what we're asking them to do, or like in your case, you had to make some serious commitments to get yourself onto one of those courses. And to do that, one has to want to get better. One has to want to improve yourself. And I think that's just something to take away for all of us, that if your client, if they don't commit to getting better, then you can't take them there. We can only show people sometimes what's possible, and they have to do the work. And we guide them through that rather than us being responsible for giving them this result or for fixing them as such.
Yeah, and that part of the journey is also a challenge to put that work on them and have the. It's sometimes useful to compare back to myself and the sacrifices and the work that I put in to be on this journey, and I won't really expect my clients to put in the same, but at the same time, you know, they are definitely responsible for their journey. I'm simply the facilitator, which we learn down the path, right? So yeah, I
how
did.
was that first level one for you? What happened on that course for you?
Again, it was crazy. I can't believe how there's so many stages to this, and there's so many shifts down the staircase and stuff that I didn't know and it kept getting further. So I ended up I was lucky enough to get matched. My partner on the course was an amazing lady called Bev, which is the one helping Douglas in the UK. So she had a lot of experience.
You were lucky to have a very experienced therapist with you.
Yes. Yeah. So it was like winning the lottery, you know, like the first time I was there, she was super experienced. She actually joined the course for herself. So she didn't want to be an assistant on the course. She just wanted to experience it for herself. And yeah, I was lucky enough to get partnered with her, and that made a world of a difference. I kind of like got this private teacher during the whole course, which was amazing. And yeah, so I worked with her. We got crazy shifts, and I only did level 1 that time, which was more than enough, I would say, because I was overwhelmed in some way with all the information and all this. So I ended up on the table on for the lat points, if for rotation and lats and all that. If some of you have done the course know what I'm talking about, and I was yeah. And yeah, it was crazy, like the way I was screaming and the way it was a profound experience. And I remember still being in some sort of like a keeping up the guard, you know. There was a bunch of people there. Most of them were physiotherapists or therapists in any way. I was just a depressed truck driver, you know. I didn't have any training in that way, and I was still a bit in a stressful state being there. But I remember when we did the stuff on the backside, the posterior stuff for the oblique sling, I stood up and it was simply amazing. It was the safest I've felt in maybe ever. And I remember standing up and just looking at everyone in the eyes in a confident way, like I wasn't the least scared. And this was coming from a guy that had to jump off stations before because I was panicking because there was people around. So I was standing up, just looking at everyone, being so. I think the part of being so vulnerable, showing that kind of vulnerability, it takes some courage going to these places because it could be scary. And for some reason, I guess just trusting Doug, and he took me to places I surely couldn't get to myself. And on the other side of all that, it was, yeah, that was insane.
I think something we like, well, the way I like to explain it sometimes as well, is just simply when you can find, if we can find where you at, and you can feel comfortable just with who you are in that moment, then suddenly everything else isn't so scary anymore. And it's actually realizing the power that you actually have within you, rather than Doug giving it to you. It's just realizing that you're actually much stronger than you remembered you were. maybe you've just forgotten where you were. And yeah, that's an amazing way that you described it.
Definitely, and that's the most beautiful part about Be Activated, I think, that I've noticed through years, and I say that to my clients as well, that we're not really adding anything to you. It's not that I'm saying do this for 8 weeks and we might see a change. That we're not adding anything new. We're just removing what's not you, and underneath that there is crazy strength, and knowing that holy shit, this was all me. Douglas was the one torturing me with his thumb, but underneath all of those screams and trauma and patterns and defense and being scared for years and years, that was all of that strength, all of that feeling that was underneath that was actually in me already, kind of. So showing that is could be profound. It sure has been for me and for my clients also, to see that holy shit, I was enough. That if we talk about hope, that's hope.
Fantastic. And Niels, the people have already heard, but they can hear that you're treating clients today.
Yep.
How do you
So
use your experience in your life when you work with clients in your clinic?
yeah, so the idea was never to do these courses in order to make a living out of it, but I already had a massage table, because in my searching for ways to get in less pain or get fixed or whatever, I got some massage courses and stuff like that, and I was doing trigger points and other fascial therapies and stuff. So, and all my powerlifting friends were also in pain, so I already had a massage table, and now I could start doing it on them. So I started treating people at the gym on a yoga mat for €5 each. So they started getting a line. Like I said, okay, I don't really know what to do, but I'll rub this in your chest, and a lot of people just suddenly felt better. So that's how it started. €5 a session on the yoga mat at the gym, like on a gym in a basement where it was chalk everywhere and people were screaming. And yeah, that's the kind of powerlifting gym that I started off in. And that eventually, now years later, now I have a sports and medicine clinic, which I see patients, or clients as I call them, and I work pretty much only um, with Be Activated. And so I start each session, of course, asking them why they're here, and then finding out where they're at, and trying to see if we can get some sort of contract. The more clarity we have, it's easier to do the work, right? So that's I explain some of what I'm going to do, and that we're going to look at some patterns and see if we can find ways to resolve that and check back into to how we feel. So that's my main goal with the first session.
Awesome. And do you share some of your story when you work with clients sometimes?
Definitely, and more lately, there have been more people coming to me because of stress and maybe anxiety, and along with maybe some pain or injury and issues like that. Because I would say that most people are still coming because they have a bad knee or whatever, because it's a
Yeah.
sports and medicine clinic. But more and more people are coming because of stress, anxiety, and issues that I could really relate to as well. So I often share my story in order to give them hope as well, because I think that's a big part of it, listening and making sure they feel safe and all that. It's such a big, isn't that really what we're doing? We're making their body more safe. That's
Well,
kind
yeah,
of,
I think that if one wanted to simplify it, I guess that is exactly what it is. And
yeah.
amazing to hear your story and how you've come from being in a really broken place to where you're actually now assisting people and using your experience to help others. That's an awesome story. So well done for that. And I'm sure it's been a really hard work that you put in and maybe still, and well done for being here and sharing your story and making a difference with it. I think that's the incredible part of it. It can just be a story of this guy's, sad past, or it can be a story where we're actually inspiring others with what we do. And for me, your story is a lot more about that. So well done. Awesome.
Thank you. And I so really what we try to do is to get them to feel something different, to get an orientation, to know where they're at in space. Because during anxiety, my experience of it, and the most things I've gotten out of this to stop a panic attack is to get more of an orientation, which basically means where you're at in space, or in life in general. Maybe not, yeah, more like where you're at. So I sometimes tell my clients that if you're a lot in your head, then it means that you're not safe. It's not safe to be in your body. So we're trying to get them back there. We're trying to get them to feel, and there's a saying I often say also, is that overthinking is underfeeling. So the more we can get you in your body, the safer you will be, and that's the goal.
And I mean, Niels already touched on it before, but some of the points that I thought to sort of chat through at the end of the discussion today is, very often clients come and see me for other stuff. They come and see me for their knee pain. They come and see me for their shoulder tension or their headaches. But then as I listen to their story, it becomes pretty evident that they living, let's say, with huge amounts of stress. And as I then start talking to them, it becomes pretty obvious that stress is really what's driving this defensive state that they're holding their body in all the time. And maybe that's now coming out in their shoulder tension or in headaches that they're presenting with. But if we really want to make a long-term difference with that client, we also need to look at least making them aware of the fact that their extremely stressful life or situations that they're in at the moment is contributing to their health. And for us as therapists, I think that's where our role comes in there, when it's sometimes just making a client aware that we could work on you every week for the rest of your life and rub your shoulders and loosen your shoulders. But if the underlying cause to all of this is the stressful life that you live, then there's other things that will have to change. And you as a therapist don't necessarily have to have all the answers for them, but I think it is definitely our role to make them aware of the fact that that's part of their problem, and then helping them to get their body to feel safe enough so that they can start taking different decisions in their life.
Definitely.
I do, however, have clients that come and see me specifically for mental health problems sometimes. So I will often have clients that come and see me for things like anxiety, for things like stress, for panic attacks, like Niels mentioned earlier. These clients are typically overwhelmed clients. They're clients that have history sometimes of post-traumatic stress. They sometimes clients with a history of chronic fatigue, like Niels has already mentioned to you in his history as well. Depression, OCD type of symptoms where they want to control their environments. Now, when I go and test them, after I've listened to my client's story and we do their pattern testing, as I do with each client, with whatever they come in for, very, very often clients from that background will be zero patterns. They will be in overwhelm. So if we're a zero pattern, it means your nervous system is in fight or flight, and your body is really just in a survival state. Your body doesn't have an effective compensation strategy. All that it's doing in that state is anything that's needed to keep you alive, and everything else gets shut down. So what Niels mentioned before, where people just become disconnected, they don't feel, they're unaware of where they are in space, they're not feeling their own bodies. There's all signs of being a zero pattern, really, where your nervous system is just numb to those things, because those things are of less importance when it's just about immediate survival. So when someone is in fight or flight, the way I explain it to my clients is their nervous system is in a really full-on heightened state. And let's say the maximum they can get to is just a little bit higher than that. At that point, this system will just cut out. So they're running in that red zone the whole time. And what happens in that red zone is you can't really change your behavior. It's all just about behavior and options that create immediate survival. So the work that we do with clients is really about, can we help them to shift their nervous system to a slightly lower state, where they're a little bit more relaxed, but what it really means is to set a little bit more capacity in their system to then start changing their behavior, to then start taking different decisions. And I really think that's the value of Be Activated for these clients, is helping them, getting their nervous system in a place where they have more options, where they can actually take decisions and are not forced to take decisions purely because of survival or because of habit. Now, Nils, does that resonate with you? Does that sound like some of the process that you went through?
Yeah, definitely. And it was this disorientation that caused this fright to be on all the time, and the control. It's much more of a letting go than adding on. Really, it's the posture that changes isn't that we build something up. The posture opens up when you let go of something. So sometimes the conversation with the client needs to be, what are you holding on to? There might be stuff going there, and everyone who's been on a course has probably know what's in the mind is in the body. So we might look at something like that. Again, looking what's going on a deeper level.
So when I explain to my clients, if they're in fight or flight, what I tell them is your body goes into some sort of defensive state, and there's physical changes that happen and tissue that then gets restricted in those areas. Your body then also reverts to going into certain compensation strategies, and changes in the way we move, changes in the way we breathe. So with activations, what we're going to try and help the client is to take away those restrictions first. Like Niels mentioned earlier, the first thing I look to do with those clients is, can we find a way for them to find their breath? That's often the most powerful big step for them, just to actually feel and find their breath again. But getting someone to find their breath is often more than just teaching them how to breathe, right? That's, well, Niels, you can tell me maybe from your experience, but that's often things that are done all along the way. But clients don't always get it right until we actually do some physical work on their body. They might be instructed to take a deep breath, but they're unable to take a correct deep breath until we've actually gone and released the restricted areas in the body that it's limiting them to breathe correctly. And once we've done that, the body almost just adjusts on its own. We don't need to teach them half the time. They just take a breath. Was that sort of something like that happened to you, Nils?
Yeah. So the autonomic part of the breath change, which is huge, right? So it was an ease, it was a depth to the breath, and yeah, restrictions letting go again, and a sigh of relief. The out breath could be just as important as the in breath. So it was letting go again.
Yeah, and particularly for clients that struggle with letting go in life, it's interesting how they normally also really battle to let go of their breath. They will often start getting the in-breath pretty well, but they can't let go of the out-breath. They control the out-breath just like they control everything else in the environment. And part of their process is sometimes just learning to let go of that breath, and with that, it helps them to actually get to a point when they can let go of some other things as well.
Definitely. Everything that I've let go of has been let go of in and out breath.
Yeah. So where I start then with clients is we go through the upside down Y. And what we're doing there is we releasing restricted tissue that's limiting them in breathing correctly. As long as that restriction is there, it's hard for their brain to connect with the diaphragm. It's hard for them to take a diaphragmatic breath because there's physical restriction to that. So we release that first, and then we teach our clients to breathe. And we help them to start encouraging them to do a better diaphragmatic breath. Now, the reason why this is important is, if we're in a relaxed, safe environment, we breathe with our diaphragms. We always use the example of, if you think of a baby that's sleeping and breathing whilst it's relaxed, all you see is you gently see the tummy moving up and down. It is our primary breathing pattern, and that's the way we breathe when we feel safe and relaxed. So what we do with our clients, we give them the ability to breathe like that, and then we reinforce that type of breathing. What we're really telling the nervous system is, we're telling the nervous system, no, you are actually safe. You're in a safe environment. And then what happens to that client that's in fight or flight, that nervous system will then slowly come down, or sometimes quite rapidly with some big shifts. So that's always, for me, the first step with these clients is, can we get them to find their breath, teach them how to do that, and then I will send them home with that as homework, using the breathing all the time, but also particularly in these situations where they get anxious or whatever their symptoms are. When they start feeling their mental complications coming on, then using the breath in that moment to lower their nervous system again, creating capacity for them to start taking different decisions in that situation. Then, of course, once we have them breathing, the next step is to going onto the zone 1 work. Now, if we can get them moving correctly from zone 1, we get the hip movement, get their psoas kicking in correctly, get their glutes kicking in correctly. That creates safety in the body. As soon as we can feel our glutes, we feel physically stronger, but we feel safe. Or maybe what Nils explained earlier, often people will just suddenly feel confident and suddenly stand up in front of this group of people and feel okay because his body is suddenly feeling safe. So those are the basics that I want to get through with those clients. And then really important is I want to then give them the skills to maintain that. So as homework, I will tell my clients that they have to, well, actually, sorry, let me take one step backwards. When I work with clients that have a lot of stress, or let's say people that struggle with anxiety, one of the worst things that you can say to those clients, and for those of you that have a history of stress or anxiety will know what I'm talking about, is to tell them, look, just don't stress about it, right? You can't do anything about the situation, so there's no point in stressing about it, so just don't stress about it. Or it doesn't help to stress about it until we hear the news tomorrow. But for someone that stresses, for someone that's anxious, they normally know that. Cognitively, they realize they shouldn't be stressing about this, but they can't actually change their behavior because they're still stuck in that fight or flight cycle where it's really hard to change our behavior. So we want them to use the activations to interrupt that process. So when they go home, the situations that causes them anxiety, whatever that is for them, sometimes it's a social environment, sometimes it's going to work, sometimes it's getting onto a bus, as Niels explained. I would suggest to them when they start feeling the anxiety symptoms coming on, that is the time that they need to remove themselves from that situation. So let's say it's a social environment and they're feeling uncomfortable in this group that they have to talk to people. I would suggest to them to just step away for a second, if possible, maybe go to the bathroom or go to the room next door, take a few diaphragmatic breaths. If they have time, add, for instance, the upside down activation, take a few belly breaths, which will then lower that state of their nervous system, and then go back into that situation and see if it feels different. Does it feel a little bit easier? And if it does, then I encourage them to keep doing that. So if they do that in that situation, it will make them immediately feel, hopefully, a little bit more comfortable. But we also want to then repeat it so that their nervous system doesn't keep responding habitually the way it does, because it's used to responding due to habit instantly. When they get into that social situation, the nervous system shoots up into fight or flight, and then they feel overwhelmed. So if they can interrupt that process every time, at some stage when they get into that situation again, it will suddenly feel a lot easier. And that's really what we want to do. We want to try and influence the way their nervous system responds habitually so that moving forward, eventually, that doesn't happen as rapidly anymore. That's the one type of advice I would give them. The other bit of advice would be to also do preparation for those situations. So, for instance, if it was difficult for Neil to get onto a bus, then I would suggest then before you get onto the bus, you do a bit of a warm-up at home. So you're going to be doing your zone 1 activation releases, you're going to be doing some breathing before you go to the bus, and then go and see if it feels different. So what he's doing beforehand is he's lowering his nervous system, creating some capacity for him to handle these stressors without feeling as overwhelmed, and then going into the stressful situation. And if needed, still using the breathing in that, and then seeing if it feels a bit easier. And sometimes, Niels, you can maybe give us some feedback on that, but sometimes it only feels a little bit easier the first few times. But the more we repeat it, it typically gets easier. Has there been anything like that for you, Niels? Is that something that happened to you?
Yeah, definitely. And as soon as you show the brain or whatever yourself that something is possible, then it will get easier, right? So as you say, that it might be just a little bit easier, but that kept refreshing that and just seeing that this could make a difference. Finding the glutes in these situations can be huge. That's what I've noticed as well. So if you need to do something, if I feel anxious or in pressure in a situation, what I would do is I would first check if I'm in an in-breath, like if I'm stuck in the in-breath, because it's so easy to remember, oh, breathe, just breathe, and we keep just breathing in. So the letting go is such a big part of it all. Let go. It's hard to take a breath down in your stomach if you're already stuck in an in-breath. The only place you can breathe is up here. So make sure you let go and find the glutes. And Douglas calls it the ninja butt squeeze, right? If you've heard about it, it's just a small, subtle little finding or squeezing of the glute. The ninja part is that it's so subtle no one will notice, so we don't need to worry about that part. So just find the glutes. It's amazing sometimes that in a stressful situation with a lot of pressure, if you could just find the glutes a little bit, that gives an orientation. The glutes, in my experience, gives such a strong orientation, which is the opposite of being all over the place, right? Then you are in one place, and that makes a huge difference. So the breath and finding the glutes in the midst of the chaos can make things a lot easier, as well as I like the preparation approach a lot as well.
Yeah, we talk about the glutes being the big container of emotion, and if one can find your glutes, it suddenly just feels everything is a little bit safer and a little bit more contained and not as much chaos. So a ninja butt squeeze is a good way of doing that, or simply doing your glute activation. And for those of you working with clients, if they do become overwhelmed whilst you're working with them, then that's where we go to. We try to get them to find their breath, and then we also add to finding the glutes. So I will often just put my hand at the back of the head. You can just hold your hand there, and as soon as they can connect with their glutes a bit more, that's normally helps them to settle down. Awesome.
Yeah, that's
Well,
great.
guys, I see an hour has pretty much almost come and gone. So I'm going to stop talking there and see if there's a question or two that we can answer for you guys. Is there any questions on the topic that we discussed today that you guys would like to ask? Dan, was there anything nothing on the chat at the moment?
Nothing on the chat at the moment, Carl.
Cool. Guys, is there anything else that you guys wanted to touch on the matter before we sign off? I think there's one there. Let's have a look, Dan.
There's one.
Can I just ask you, Nils, whereabouts in Sweden are you?
I'm in Malmö, so it's the very south of Sweden.
Okay, I grew up in Sweden.
Really?
Yeah, an hour from there. But I've got a friend, so I wouldn't mind if I could somehow get your contact details to refer my friend to you.
Yeah, of course, we can set it up.
Because I'm in Australia these days, so long way away.
Yeah, sure. We can. Yeah, I'll figure that out. Maybe we can get together on the Facebook.
I can connect. Eva, if you just remind me, I can connect you to Nils afterwards. Yeah.
That'd be
Perfect.
awesome. Thank you.
Perfect.
Just give me a reminder. So I see Dan has got a question there. It's more sort of in general about activation. So Dan, you're asking, it's a big one, but how do we guide people towards activation when we know it can help? In my case, I'm a remedial massage therapist, but all I want is a rub. Now, the short answer I will say is to show them a little bit about the work. What I used to do with my clients when I still did very much conventional physiotherapy and then switched to doing activations was showing them their pattern. I think that's pretty key. So whatever they're coming into you for, if it's lower back pain or for a shoulder injury or whatever it is showing them their pattern and showing them how their pattern is typically linked to the overload in their body. And then explain to them, once they understand their pattern, that can you see how your pattern is underlying to what is probably causing these problems for you? And if we really want to make a difference in the long run, is we need to address that pattern and get you moving differently, as opposed to just rubbing your sore shoulders. That would be my suggestion, is to start with a pattern, because once clients understand that this is actually the underlying cause, would you want me to try and address that, or do you just want me to rub your back, which is probably just going to give you symptomatic relief? Then most clients are pretty happy to say, no, fix the problem. And I think that's the best way to go about that. Yeah. I see let's just have a look if there's anything else there.
Yeah, Carl, there's a question about Parkinson's. I don't know if we wanted to go into that today.
I think it's probably a discussion for another webinar. But the question is, I have a question for Parkinson's. Oh, yeah, look, I think that's probably going to open it's one of the future topics for one of the future webinars is talking about neurological problems like that. So I think let's leave that one. It's going to be a bit of a long answer to do that quickly.
Jack has a good question here, Coral. Typically, how long to wait before you see your patient again?
Look, I think it's a question that often gets asked, but the answer is that it could be different for different therapists. The way I work versus the way a lot of the therapists on this forum would work would be different. The way Dane works in South Africa is different. The way Doug works with clients in South Africa is different. But I can tell you what I do. So I typically see clients once a week. So if I see them today for a session, I'll normally follow them up the following week. But the main reason for that is typically because of my schedule, and I often don't have time to fit them in any earlier than that. And once a week, for me, works well enough. You could see them more regularly than that. There's not a steadfast rule with that. In the old days, I used to tell my clients that they need probably 2 days, 3 days in between sessions, purely because of the treatment tenderness. And that was a consideration that I used at some stage, but it could really be anything. If I have a client that can only see me for 3 consecutive days, then that's what we do. So anything is possible. I think one has to see, firstly, what fits into your clinic environment. Secondly, what is possible for the client. And thirdly, really important, I think also what's comfortable for you as a therapist. Because that in the end has to be a big part of the decision, is what is doable for you within what is still going to give your client good value. So I don't have a specific answer for you other than there's different options. Is there anything else there, Dan?
Would you have any advice on how to find your breath? I see Sylvia's just asking a question. She says she finds it difficult, or a patient finds it difficult to use her breath. Any kind of tips on how to get them there maybe a little easier?
I think something just to remember, with some clients, you'll literally touch the upside down Y, you'll do a little bit of releasing, and they just take these massive breaths, and it happens all that easily. But with a lot of clients, it doesn't. Sometimes you will work through all of that, and they really struggle to get their breath. They really struggle to find how to shift their abdomen. So I always say, I think it is important to try and get a reasonable breath out of your client before you move on from the diaphragm. But it doesn't have to be perfect. So for me, as soon as my client can get a reasonable movement of their abdomen forward as they're breathing in, and they can let it go to some extent, I will move on, because you'll typically find if you move further down the chain, once you've released their psoas, possibly by the time you get to releasing the quads by releasing the abdominals, then suddenly their breathing kicks in. So there's often other restrictions further down the track that is limiting their breathing. So move through the sequence, and often you'll find as you move further through the sequence that their breathing improves more and more as they go. There's also some clients that I end up having to send them home with a reasonable breath, and that they need to go and practice it. And there is sometimes a component of that with them practicing it for a couple of days, then coming back. And if we then teach them again, then suddenly we get a much better result. So it's not always as easy with each client. Is there one more? Then I think we'll leave it there if there's one more, Dane. What do you see?
No, I see Anna's just asking about like if there's a video for like a full body self-activation sequence, but I don't think there is one.
Yeah,
I know of.
Not to my knowledge. It's something we do sort of cover, well, not normally, but often on a level 2 course where we go through the full self-activation sequence. But there isn't a video like that available, purely because I think people also need sort of guidance with that. So it's not sort of available to the public as such. There is some basics on my Instagram. There's done one self-activation routines that I've recently posted, if that's of value for you. Yeah. Guys, I think we're gonna call it there for the night. Thank you very much for everyone that attended. I hope you've all learned something. It's been a big pleasure chatting to you, Niels. Thank you for sharing your story with us, and for all of us just to realize again that it can have a massive impact on people's lives when we just help them unlock their own physiology. And sometimes it's more about them just realizing again what is inside of them really than what we're giving them. And Niels, thank you for sharing your story. It was amazing to hear again. I hope you've all learned something from that. And we will hopefully see you all again back in 2 months' time. We'll have another one, and the topic will come out a little bit closer to the time. Thank you, guys. Have a great evening. Good seeing you all here.